All right, so good evening, everyone. So we'll start with the session. As I said, that today we are going to discuss about the writing. So total in writing time duration, you know that it is 45 minutes, 5 minutes only for reading and 40 minutes for writing, which is enough. And you should even keep this 5 minutes for proofreading at the end, which really helps. So when you practice, make sure that you plan the things, organize it well before you start writing, and then take only 30 minutes to write a letter. This is a maximum time that you need actually. 30 minutes are enough. So you need at least 10 minutes in starting for the preparation, to plan, to organize, to transform the case notes and everything. So that's important. All right. So guys, you can mute from your side. I can hear some beep sound. Now, important question is that how you are going to be assessed, how the examiner is going to give you 350 score. That's important to understand. You know that this writing assessment criteria, which is on our OET website as well, and they talk about certain, the assessment criteria and the scoring for that. Now, this seems to be quite complex, so I have made it in an easy way. Now, this is another form of that. So the first point, the first assessment criteria is the purpose. Purpose means that why you are writing a letter. For that, there is a 3 score. So your introduction, when an examiner will look at that and see, okay, you have clearly mentioned the purpose. It's quite quick and precise, makes sense. Then he'll get 3, 2, 1. There's a scoring like that. And similarly, there is content, which talks, now rest all has 7, 7 band it gives you. Content, of course, important and relevant information. In another way, we also call it explanation of the purpose. So whatever is your purpose, you are going to explain that in the first paragraph, that is called content. Okay. Now, third is conciseness and clarity. Again, 7 band for this. If you are mentioning precise and clear information, then genre and style, 0 to 7 band. Again, no personal understanding. Never use write this kind of things. I believe, I understand, I feel. No, I never use I. Okay, and no medical abbreviations. Universal, acceptable, but not the local one. Organization and layout, that how you have structured, you all know that there is a fixed criteria for that, fixed format for that, and we will look into that in detail one by one. And the last one is a language. Of course, your grammar, spelling, punctuation, vocabulary, everything instead comes in the 7 band. Now, to get a B, you need a score in between 350 to 440. 2/3 of the score to get B comes from the purpose. It is that important. If your purpose is wrong, no examiner is going to read the rest of the letter, because in starting itself, you're wrong. Now, 5 by 7, this score comes from the percentage I'm talking about, comes from the other criteria, but purpose is very main. So now we'll discuss these points in detail, that what exactly, how you have to write the purpose. It has to be immediately apparent and clear. So when I say apparent and clear, that means the clarity is very important. That why you are asking me, why you are writing me this letter, why it is so important. Okay, so you have to introduce this purpose in the introduction, and then later on the same purpose should be explained in the first paragraph, that is called expanded on later. Now, as you should, as the examiner in the sense, I'm the person to whom you are writing a letter, right? I should be able to identify the purpose immediately without wasting any time. I should get it quick, okay, in a first line itself. And what are the specific instructions? Like say you're requesting for a home visit to maintain her ADL, especially the dressing and other things. You don't need to write everything in the introduction, like she needs assistance for dressing, for showering, and for XYZ things. In fact, that things you can explain in the first para, and very precisely like ADLs, you can write in the introduction. Now, ADLs, it's again an abbreviation. You will not use that. You'll just activities of daily living. Okay. Now, it's very important to remember that why you are referring this patient to the specific person. If you are writing to the um, orthopedic surgeon, then it should be referred that why now. You know, if a patient had a problem with the surgery a year ago and you are referring now, then it should be specified why now. Remember that. That's very important. Okay. Now, just for your quick this, I have given you a patient detail as well. The patient name, Jake Peterson. You are a nurse at a boarding school. I've given all the relevant information. So whenever you get the purpose introduction, you need the first line of the task, which I've written that you are a nurse at boarding school. Jake Peterson is a male student at your school and has come to you complaining of hair loss and associated depression. Name given. Now, this is the last part of the task, writing task, which says student concerned about transition to university shortly and independent living, letter to university medical practice. Okay. So monitor and organize special exam arrangements. I got the plan at the end of the task which is given, and the writing task says write a letter to Mrs. Coolen, a university practice nurse. Address this letter to a senior nurse practitioner at the university. So I am giving you 2 minutes to write a quick introduction. If you want, you can write directly into the chat box, or you can write on your notepad and can tell me. You guys have 2 minutes for this. Okay, so I hope everybody has written. Yes, Renu?
Yes, ma'am. Ma'am, I have written like, ma'am, I'm writing to request for Mr. Jake Peterson, who requires your attention as he has been experiencing from hair loss and depression.
Mm-hmm. Okay. Written hair loss and depression. Okay. What else?
Yes,
That's it?
yes, ma'am.
Okay. All right. Anyone else, Meenu?
Yes, ma'am. I'm writing to refer. I'm writing to refer Jake Peterson, mm, who requires monitoring and special exam arrangements upon his transition to your university. He has hair loss and associated depression.
Hmm. Okay. All right. Anyone else?
Ma'am, can I?
Yes, please.
I just wrote, I'm writing to refer Mr. Jake Peterson, who requires your assistance to organize arrangements for his university exam. He has depression due to hair loss.
Hmm. Okay. So, yes, anyone
Ma'am,
else? Yeah.
I am writing to refer Jake Peterson, who has depression followed by hair loss. He
Mm-hmm.
requires monitoring and organization for special exam due
Mm-hmm.
to his concern about transition of university.
Okay. So you are trying to say that he's getting transferred to university. That is why he needs special exam arrangement. As you said, due to. No, that changed the
Mm.
meaning. But actually, it is not like that. Okay. Anyone else?
Uh,
Okay. Now remember, you are a nurse at a boarding school. It's a boarding school, right? Your Peterson is a male student at your school, has come to you complaining of fear loss and associate depression. So this is his regular problem. Okay. Now, student at the task and again, student is concerned about transition to university shortly. So now he's leaving the school and is moving to the university, right? Will he ever come back to the school? Anyone? Or this is a permanent
yeah,
No,
transfer?
no, ma'am.
no, for exams only.
Ah, you're saying for exams only? Okay, all right. He is moving to university. So he's worried about that. That how
Mm.
will he live independently? Because till now he was living in a boarding school.
Mm.
Yeah, so any student never go back to school. Yes? So he is not gonna back to the same nurse where he was, but he's moving to a new place in the sense new university, where as a you are a school nurse and you are updating a university nurse about Jack Peterson's condition. So you have to give a complete handover. So basic concern that why he's so concerned because he's gonna live independently now. That's what is worrying him. So because of that, anxiety level has probably increased. So what's the issue with that? That's the other thing. But yes, other second thing is given. This is a 1 point. Second point is given monitor and organize special exam arrangement. This is a secondary purpose, not primary. Primary is monitoring him as he's going to live independent and he is worried about that. Okay, let me show you an example. So this is actually an same example given by OET as well. So I feel that 18-year-old student at this school, you don't need to write if you have already written in the first part of the letter where you have written the salutation. After the salutation, you write the in name and age of the patient. So if you have written there, then no need to write in the introduction. So you can write directly, I'm writing to introduce Mr. Jake Peterson. Till now, if I'm a university nurse, I'm not aware about who is Jake Peterson. So you need to tell me that he's gonna start his university, he's gonna join your university. So I'm writing to introduce, or I'm writing to inform you about Mr. Jake Peterson, who is about to start studying at your university, or you can write the name, or you can also write at your university. And Jake presents with presents. This is a simple present tense. That means he has this problem. Jake presents with hearing loss and associated depression and anxiety. Now here, if you want, you can definitely write the second point as well, that he requires continuous monitoring and special exam arrangements. Now that's my complete. Now very important is to understand that you are giving a complete handover to the new nurse who is not aware who is Jake Peterson as of now. So you have to tell me that he's gonna join university, and this is the problem. Got the point? Yes. So that's very important to, or you can also mention, it's not going to be wrong that I'm writing to um, update you about Mr. Jake Peterson, who is joining university shortly and is worried about independent living. It requires monitoring and organized special exam arrangement. Now, these are my purpose and the current situation. In introduction, we always mention three things. As I always said, three things are important in introduction. Number one, purpose. Number two, the current situation. And number three is the discharge plan. Now, since in this letter, there's no discharge, so you are going to write the purpose first, transition to shortly worried about independent living, required, this is the purpose, monitor and organize special exam, and current situation is that he experiences hair loss and associated depression. Is that clear? Now this is the complete introduction. I hope you got the clarity.
Ma'am,
Yeah.
can I ask one question?
Yes.
Ma'am, if you write the primary purpose without writing the secondary purpose, will it be complete?
I didn't get your question. If you will write the primary purpose without secondary purpose.
Without including secondary purpose in the paragraph, will it be?
Well, now you have to write both the purposes. It's a good point to mention both the points. However, when there are two purposes, the first purpose, which is the primary purpose, you can explain in the first paragraph, and secondary purpose in the second paragraph. You don't need to the secondary purpose in the first paragraph.
Okay. So, ma'am, but in this task, if we are including like the patient is going to leave alone, but we don't include the monitor and organize the special exam arrangements, then it won't be complete.
Ideally, if I
right,
say yes, it won't be complete.
Okay.
So it is good if you write the both, of course, to get, if you mention everything, three, because this hair loss and associated depression is the current situation, not the purpose.
Yes.
Yeah. Purpose is, this is also that he's concerned about independent living is also current situation, is worried. Now what I have to do, I have to monitor him and to organize a special exam arrangements. So two things.
Okay. So we can include that point that he's going to leave alone. That we include in the first para. Is
Yeah.
that right,
So
ma'am?
monitoring will come in the first para. Monitoring regarding what? Monitoring regarding his anxiety due to hair loss and associated depression. So all that explanation related to the hair loss and depression would be in the first, and second
First
paragraph
one.
would be why he needs special exam arrangements.
Okay.
Got it? Now that's what I
Ma'am,
tell
I
you
have
how
one
it's
question.
yes, please.
Ma'am, as you told, we can write two way. That means I am writing to introduce. Otherwise, I am writing to update. This update means this new. They don't know no this student first time writing no. So we can write it like
Ye-
update.
Update actually, she hasn't no, but the student has enrolled in the university. But yes, very pointly said, update would not be the right word in this situation. The best word is the introduce,
Introduce. Okay.
inform. You know,
Okay.
that's another word.
Okay.
Yeah,
Okay.
because we are not still aware that this patient is has enrolled or not.
Yeah.
Yeah.
Okay.
Thanks for
Ma'am,
highlighting it, sir.
can I
Yes,
ask one more doubt about
yes,
the
please.
purpose? Ma'am, if in the purpose, ma'am, in my previous exam, they given like there are two that they are suspecting the patient is having. One is glandular fever. Then they put a bar and they say that tonsillitis. So how
Mm.
can we form such a sentence? Can we write or the patient is suspected to have A or B, or how
Yes.
can we write A and B?
Okay. It is the
Which one is right?
oblique. The sign was oblique.
Yes.
Okay. And were they question mark for both?
Yes.
Okay. So then you can say or. Okay. So you are suspecting either he has glandular fever or he has tonsillitis.
Okay. So if we
Oblique
write
is
the
or.
and,
Sorry?
if we write the and, then it is wrong, ma'am.
No. They'll not cut marks for that. Definitely no.
Okay, ma'am. Thank you so much.
Okay. Anyone else has any questions? Okay. So can we move?
Yes, ma'am.
Yes, ma'am.
Now, second important assessment criteria, which has 7 band, is content. You know, how you choose the relevant information. If you write, you know, as most of the time we have seen in certain letters, when you start, recently I noticed, let's say there is a patient whose sugar levels are quite high. And when he comes to you and you have referred the patient to the endocrinologist. Now, if you will start your paragraph that Mr. X has been diagnosed with diabetes since 2007 and he takes this. Now, that is a very wrong start. So, that's not accurate information which I need as endo. I need to know what happened now. Why you are referring this patient to me now? So, all the relevant information you should be able to identify the necessary information. And if you have expressed that information accurately, you did not change the meaning of that. You know, sometimes we translate the sentence and transform, while transforming, you change the meaning. Now, I read recently something, he used to eat a lot. But however, in the text, it is written that he eats a lot. He used to eat, used to. I recently noticed in someone's letter, used to is a word which we always use for past things which I don't do now. For example, if I used to play hide and seek in the childhood, I don't do that now. So I can say, I used to play this hide and seek. So anything which I was doing in the childhood, not doing now, then we use used to tense for that. So saying that he used to eat, however, in the task it is written he eats now, that's why his BMI is high, then that's the wrong information. That's wrong meaning. You have expressed in a different way. Okay, now if you have written all the relevant information and you have transformed it accurately, and you are aware that I'm writing to a medical person or a non-medical person, and you have written in that way, and then probably you'll get 7 band for that. So basically, content means what a reader wants to know. If I am a person to whom you're writing a letter, I want to know all the explanation of content in the first paragraph, that why you are writing this letter to me. That is the meaning of content. If you have well explained, you will get 7 band for that. Clear? Now let's take an example from here. Now this the same letter which we just did the purpose now. Now here in this, the social background is given, presenting complaints are given, treatment summary is given. Yeah. And rest of the few dates are given, that this and this happened from 2019, this happened. A lot of dates are given in this task. All history, that when his problem started and what happened in between, everything. How many of you have written this letter before? Anyone has written this? Hello?
Yes, ma'am.
Yes. Okay.
Yes, ma'am.
Okay, so I think I've checked few letters, so you guys remember it. So basically, I'll show you this sample. Now this is the first paragraph after the introduction. Now if you read this first para, you will see that it started like when the initial problem started. Now since I told you in this letter there is a complete transfer of the patient is going to a new place, so I have to start his problem from starting, because this is not something for a specialist what I'm writing. So I need to tell that initially he presented to me when he was 13 years old, and he was referred to this, he did this, he applied cream, however there was no and this thing, and he started taking homeopath and got these problems. Now that's the one thing which now this paragraph gives the answer to me, that why he requires monitoring. Because the last line very clearly says there was no improvement with the treatment and he was referred to a counselor but failed to attempt the appointment. So I understand, okay, so I need to monitor him. All right. Now, second, over the recent school exam period. Now, I'm telling the person because in a recent during the school exam, Jake suffered in better experienced extreme anxiety and a worsening of hair loss. His alcoholic consumption has also increased to 28 units per week. Okay, and a special exam room was arranged due to his increased anxiety. Now, this paragraph gives me the clarity why he needs that. Now, if I have written all the relevant information like this, and then of course, I'll get the 7 for that. Okay, so this is how they select it. Now, again, I just want to emphasize here, there is no fixed format, let me tell you. Every letter is different. It depends to whom you write. As I just gave you an example, if I'm writing to a neurologist and he suffered, a patient had a fall at home today, and I expect on my assessment, I expect a head injury. So I'm writing this letter to a neurologist on an urgent basis to evaluate this patient in an ER. And there are some few dates are given that previously this patient visited the clinic, my clinic, with headache and with some migraine, with certain medications were given. Now, most of the candidates, what they think that, that I should start with starting because fall happened due to severe headache. But do you think that you're going to mention his earlier initial visits of headache, first paragraph, or today things in the first paragraph?
Today's.
Yes, today's, because I am not referring to the neuro because of headache, not because of migraine. I'm referring because of fall as I experienced, as I expected, the patient has internal head injury. So you must write the same thing in the first para. If you will start from the initial visits, wrong. Okay, so there's nothing fixed. It depends to whom you write. All right, so I hope it's clear. Yes?
Yes, ma'am.
Yes, ma'am.
Okay,
Yes,
great. Third point, third assessment criteria, again 7 band for this, conciseness and clarity. How relevant and concise information you give. Now, what do you mean by concise? That means your letter should have body should have 180 to 200 words. And I think I've told initially, no examiner, they count the words, but yes, they look for the relevant information. So if you have included all the relevant information, then it automatically your words will fall under 200. But if it is you have written some irrelevant, then probably your words limit has increased. Okay, so you must focus on, other than word, don't waste time in counting the words. Your focus should be on selecting the relevant information. And how you have, summarized that information in a clear way. If I'm getting, as a medical person, if I'm getting all the information clearly as a neurologist, okay, what happened? Okay, his BP was high, his BP is 160, 90, da, da, da. Now, never write to the doctor, write his BP was high. I'm a doctor. If you will tell me his BP is 160, 90, I know it is high. So never tell high or low, unstable or stable. Always give the clear figures to the patient, to the doctor. Even for the reports, if a cholesterol level is high or low, no, write the figure. He knows it's high or low. You don't need to tell him. Okay, so same way, if you have summarized that information nicely and I am getting all relevant information, and the way it is presented to the reader, it clearly understandable, then I'll give you 7 band for that. If it is distracting, you have written something else, you have included the present also, past also in the first paragraph, and I'm getting confused, that why you are writing to me now? Then probably 6, 5, 4, 3, 2, 1, 0. So like that, they have a scale, they'll rate you based on that and will give you the score. So next is genre and style, the way you have written in a manner which is suitable for the audience. Now your tone has to be very polite. If you're writing, you should do that. I always avoid this word should. Should is more sound like order, instructions. I want to. No, never. Would is a more appropriate word, polite word. Okay, so especially you have to keep in mind while handing over that there are, it is different in referral transfer and a letter to a caregiver. It all matters, a different discharge letter like that. So all the informations are different. The style of writing referral and transfer is almost similar. However, discharge letter is entirely different because it's a known case. And in transfer also, a person is moving from one place to another. He's not gonna come back to me. So I should give all the information from the starting. When he admitted this and this happened, surgery was done, post-operatively he was this was done, and now he shifted to rehab for further exercises or to maintain the mobility, like that. But when it comes to the referral letter, you are writing to a person. So it depends to whom you write, and you will select the information based on that. So there's nothing fixed that you will write the first paragraph again, admission details. No. If you're writing this letter to a social worker, to an occupational therapist, to a dietitian, you know, what's the priority for them will come first. So you're not going to tell me that he underwent surgery, blah, 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 information, which is as a dietitian maybe not relevant for me. Okay, so if you are able to select that, then there are 7 bands for that. Now, this is very important. The language needs to be clinical and factual based. There should be facts, okay? And you're not going to give your own judgment. What are you writing? It should be based on the facts which are given in the task. So that's the meaning of facts here. So professional tone, of course, it has to be in a polite way. When you say kindly do that, please ensure that he get this on time. Kindly monitor his medications or exercise. So it has to be in a very polite way. And no medical jargon and no abbreviations. Okay? So that's what you need to keep in mind, that if I'm writing this letter to a doctor or a nurse, probably the both are directly dealing with the medical things. So they all, it's okay to share a medical information with them. But if you are writing to a non-medicals, now different medical line, for example, all these other categories of occupational therapist, social worker, dietitian, physio, they all comes under this category. They don't need that deep information about the medication, about the treatment and diagnosis or assessment. No. So everything will change. But if I'm writing to a doctor, I need to tell patient presented with this problem, this has happened, this investigation was done, which showed this, and diagnosis was confirmed, and this is how he was treated. But if same thing I'm writing to a dietitian, which is irrelevant, all this information. So if you are using the same format, probably it gives a very wrong picture to the examiner and will give you directly C without reading even further. Now, third point also, that if you're writing completely to a non-medical reader, for example, parents, you are updating the parents about the child's condition. Yeah, you're writing to a director of some department. We have done a lot of letters like veteran affair. The patient need some financial help, so you're requesting them. So all they are non-medicals. So you need to keep in mind the person to whom I'm writing is a medical line or a non-medical line. Okay. Now, fifth one is organization and layout, how you have structured. The letter has to be, I always say, your handwriting, there is no marks for handwriting, but yes, at least it should be readable. Nobody's gonna focus. If I'm not able to read, I'll not try hard to read that. So make sure at least it should be readable. Okay, so here the good thing in organization here, you have to give a very clear information. It's not like IELTS. I don't know if you guys have given IELTS before, but in IELTS you need a very different kind of approach. You need a complex sentences. You need to have a different approaches, a question form, and various forms of the sentences, and to show that you have a good command, a high vocabulary. In OET, you don't need anything like that. It's very simple because OET says that they need very clear and precise information. No vocabulary, simple language. You'll score high if you will use a simple language. The only thing you need to keep in mind that you're selecting and writing in a precise way. You're not writing like a story. On this date, this has happened. On this date, this has happened. If there are 10 dates and you will describe every date like this, you will not be able to finish in time and in that 200 words. So you need to select the relevant information out of 10 dates and see what are the changes in that and write takeouts and write like in frequent in last 1 month he visited he visits us on very frequently with this problem. You don't need to write everything. Layout has to be appropriate, the way you write date. Some people write date on the top, some write it after the address. Both are acceptable. Salutation, how do you close? It's how do you do that? Of course, there is a score for that also. And remember, the best thing on OET, there is no fixed template. If you will say that, okay, I will write the admission detail in first para, second social, third discharge, no. There is no fixed templates because it will change and it depends on to whom you write and what is the purpose. So based on these two things, your style, your format of letter depends. So keep this out of mind that I can learn by heart and I can know if that's the only way to write. No. Okay. Now, yes, the last one is the language. Yeah. And language, of course, does your letter have accurate vocabulary, grammar, spelling, punctuation? All this is important. Okay, so what they expect you to use accurate and in an appropriate way, and don't show that you have a very you're writing in a very complex way which is not able to even understandable. It shouldn't be in that way, but yes, you should keep write the very clear cut information. So that's what, if you will keep all these points in your mind, it will be little easy for you to score high. Okay, now I'm gonna just share a few strategies and tips and some rules which are, we'll discuss about some common mistakes, probably that will help you to understand. Now, a very important part of grammar is articles. A very, it's a very common mistake. We have to use article. We write every time Mr. X was admitted to the hospital. When we write the hospital is wrong. Why it is wrong? Can anybody tell me? Okay, so it is wrong. Why? Because the name is not specified of the hospital. It's a general. It could be any hospital. When I say hospital, it could be any hospital. But if I'm saying that Royal City Hospital, then I can say, yeah, Mr. X was admitted to the Royal Hospital. Because I've mentioned the name, I've specified which hospital. Okay, so similarly, there are some nouns with that. Articles always comes before nouns, so you have to start your subject with the nouns. And another thing, yes, it is a good way if you want to score high, you use a simple tense, compound tense, and complex sentences. Simple, we just say like a simple words, like Mr. X experiences pain. This is a simple sentence. Compound, Can anybody give me an example of the compound sentence? Yeah.
Mr. X has had hypertension since, for which he is.
That's a complex.
Oh, correct.
That's
For
a
which.
complex. When we say
Yeah,
for
and.
which, yeah.
Yeah,
With
yeah, sorry.
Yeah.
Yes.
Yes. So compound is example for that?
And
Yes, we use and with that.
as
Yeah.
well as
Yes. Okay. So make sure you use these three sentences. And of course, the subject verb agreement. These are the common mistakes of the grammar, which I'm showing you. Articles, very commonly seen, common. Then subject verb agreement. So can you tell me if this first sentence is right or wrong? Ibuprofen and paracetamol were suggested for pain management. Is this right or wrong?
right, ma'am.
Second one?
That I'm not sure.
That
Come on, anyone? Third one? Just
third
make
one correct.
third one correct. And second one?
I think all sentences are correct.
Correct.
Confused, huh?
First,
No, three. I think in my view it's three. 1, 2, 3. All it's correct.
Yes, this all three are correct.
Yeah.
Yes?
Yes, ma'am.
You don't have to be confused. It's all correct. So you need to remember now when we say ibuprofen and paracetamol, and means we are giving both.
Yeah.
Yeah, were suggested for pain medication, for pain management. Okay, were because the both two medicines, of course,
yeah,
plural,
plural.
were. So when we say ibuprofen or paracetamol was suggested, this is also correct because either one has to be given. So if it's one singular. Now third one says ibuprofen or similar drugs.
Yeah,
Drugs.
drugs plural. Yeah.
Plural. So what is the next to that verb? We always consider that. If I write in a different way that similar drugs or ibuprofen was suggested. Is this correct?
No, ma'am. It's a drug or
Yes, Sasha. If I will write similar drugs or ibuprofen was suggested for pain management. Is this correct or not?
No, wrong.
Wrong. Why?
Drugs.
Drugs were first, right? Ibuprofen is only one, singular.
Yeah. So
Then
was
it
is
will be
correct, na?
was.
Yeah, that's what
Yeah,
I'm saying was.
ma'am, actually I heard
Okay.
there.
Yeah,
Sorry.
that's what I'm trying to tell you guys. Please listen carefully. Those who were saying me that it is correct, it's wrong. So if I say like third one says ibuprofen or similar drugs were. Now were next to were here is a verb. Next to it is given similar drugs, which is a plural. So I will always consider the next one. Then I will consider it were. But if similar drugs is written first and then ibuprofen or ibuprofen is a singular. So I will write was suggested for pain management. I hope it's clear to everyone.
Yes, ma'am.
Yeah. Okay.
Which one before this were single or plural like that depending, no?
Yes.
Okay.
Clear?
Yes, ma'am.
Right. Now, these are the common mistakes in writing. And this is some nouns are there who don't need an article. For example, all therapies, medication, chemotherapies, and all, and medications, they don't need any noun. Remember that. Ibuprofen, the ibuprofen, we don't use any articles with that. I hope you guys are making notes.
Yes, ma'am.
Yeah. Second point, it's very common we see this often problem with the articles. But yes, you need to keep in mind we don't use again this with any procedure, operations, or investigations. We don't use article. Okay? Procedures, operations, investigations, all are plural. And the third point, never use articles with medical conditions such as, for example, a cancer, a hypertension. We never use a hypertension, a Parkinson's disease, a dementia, because it is a group of problems. Okay, so with these medical conditions, you will never write, use the the articles. I think the fourth point I recently explained in the class, if you guys remember, very commonly it is used rule
Yes,
out.
ma'am. Exclude, as you mentioned, the meaning.
Yes, yes. So when we say rule out, most of you say, it would be requested if you can rule out the problem of dementia. Basically, you are saying it to confirm. Yeah, but it's wrong. Rule out is not means confirm. Rule out means excluded. So this is a very common mistake. Please keep in mind. Rule out means not confirm. Rule out means excluded. You did some investigation which seems to be normal, and so that means there are no further chances. So you have ruled out the option of any viral infection. Now, fifth is, now this is also very common. Sometime in a hurry, you write I complained, just a matter of I if you look at the spelling. Complained and compliant. So keep, but it will change the meaning. If you will put I before A, then meaning will change. So keep this in mind because this is also seen very often. Okay. So complaint is different. That patient presented with a complaint of headache, and compliant, he is not compliant with his medication, with his diabetic medications. Now that is entirely different. Yes, this mistake, the last one, even I see in your letters even now. I think I've corrected it many times, but still I quite often see there's a lot of difference between advice and advise. Even in the sound, there is a difference when you pronounce it. It's a advice, advise. It's a, so there's a lot of difference in the pronunciation. So can anybody explain me the difference between advise and advice?
One is noun,
Which one is noun?
CE.
CE is a noun. Okay, SE is a verb.
Yeah.
Okay, so can you give me an example for both?
He has been advised, that is the verb,
Mm-hmm.
SED.
Mm-hmm.
He requires advice.
I would like
CE.
to advise.
Let me make it very clear to you. If I need advice, that is noun. If I'll say, hi Asha, I need your advice, that is CE. because need is a verb. I need your advice. That's noun. But when I have to give advice to somebody, it will change to verb. I would like to advise you.
It's clear, ma'am. It's very simple way.
Yeah. Yeah.
Yeah.
So he has been advised. Now here he. Advice when I need, it is advice. When I have to give somebody, it's verb. Got it?
Yes, ma'am. Very clear, actually.
Great.
No one has taught this way.
Okay. All right. So yeah, good thing is that it's clear. I hope it's clear to everyone.
Yes, ma'am.
Yes, ma'am.
Great.
Yes,
Okay.
ma'am.
So now you will tell me what is right and wrong here. Let's say the first point, he was presented with. Is this correct?
Wrong.
No,
Versus
wrong.
wrong.
He
Okay.
presented.
He
Why not
presented.
was?
He himself only presented.
Himself came.
Yes. He was admitted, of course, by someone. So this is correct. Second
Yeah.
point, he underwent surgery and he has undergone surgery. Very commonly used.
Yeah, both it's
Ma'am,
correct, no, ma'am?
Correct.
Both is correct?
Yeah,
Yeah.
it's one is present perfect.
but ma'am,
One
when
is in
we'll
the
use
past.
underwent surgery, so we have to mention the date and time with
Yeah,
along with.
Is it?
I too
Or
learned the same way.
recently, or some back.
Has undergone.
Okay. Both are correct. Okay. And however, I just want to specify it. Let's say patient admitted now for a surgery and underwent lab chole. Now he's getting discharged. So you are writing a letter after discharge. So recently underwent surgery during this stay, which you are gonna write. So that means you will use only simple past tense. You will not use present perfect tense. Simple past. Okay, the date and time which you said, probably that's for the past thing, Renu.
Okay.
Okay, remember for the recent surgery, we always used simple past tense.
Underwent.
Yeah.
Yes.
So
And ma'am,
yeah.
when we can use the has undergone?
Okay. Now, can anybody give an example for this?
In past, not recently.
Mm-hmm.
Previous admission or something.
Mm-hmm.
Or this this time he admitted,
Mm-hmm.
but later 2 or 3 months later only we are writing this letter.
Mm. Okay. All right. See, we can write this. He has undergone surgery for laparotomy earlier. Okay. Let's say the patient has come for anything, and you have seen the same surgery was done previously as well. Like we recently did in speaking CABG. Yeah, patient readmitted after
Yeah.
6 months.
Yeah.
So in that situation, we can say that, yeah, I know that you have undergone a surgery 6 months ago and you're readmitted again. So in that situation, we will use undergone. As she said, you should have a time period. Clear?
Yes.
Okay. All right. Now, third is he has had diabetic mellitus and hypertension since, and he has DM or HT. Which one is correct?
First one.
First one, okay. His wound healed and his wound was healed.
His
His
wound
wound healed.
was
That is correct.
Was healed?
Was healed, ma'am, correct, I think.
Mhm. Yes, anyone? Why? Okay, let me first make it very clear. His wound healed is correct. Wound was healed is incorrect. It's wrong. But can anybody explain that why it is wrong?
It's itself healed.
Yes,
Yes,
it's
ma'am. It's
self-healed.
already in
Yeah.
past. Past. Yes, ma'am.
See, let me tell you in a simple way. When there is a natural process involved in something, you can't make that thing passive. Like the first one we did, he's presented because self-presented. Wound heals on its own. It takes time. But the healing happens. It's a natural process. It takes some time, like we say 4 to 6 weeks. It will heal on its own pace. So it doesn't need any assistance. Nobody is involved into that. So that's how this is a natural thing which heal on its own. So the passive is wrong. Is that clear?
Yes, ma'am.
Ma'am, I have one concern. Is the
Yeah.
wound, we are providing the dressing and medications for that, right? So because
Yeah.
of that, it's healing.
No, if you will not do, you think the wound doesn't heal without that?
No, in the hospital situations, we are providing the dressing.
Yeah, we
Yeah, that,
do.
yeah.
But it doesn't mean if I'm doing a dressing or I'm applying a medication, it will heal in 1 day or 2 days.
No.
It takes time. That's a
Yes.
natural that's a natural process. We say normally, that every wound it takes 3 to 4 weeks to heal. Depends on the size and how deep the wound is. So the normal process we say that yeah, normally it takes 2 to 3 weeks to heal. However, in diabetic patients, it takes some more time. Normally we talk in that way. So it is a natural process. It's not that you are doing a regular dressing and that's why it is healing now. Yes, that is a different thing, but wound healing has its own process. This is natural process. But this is a very common mistake. That's why I'm specifying it. I'll tell you, you're saying the daily dressing, and I think this is 20 years ago. My grandfather was bitten by a dog, and he is a retired Air Force officer. And what he did, usually this is what they do when they are on mission. They said, we don't carry the medications, the treatment, and bandage. So what he did at home, he washed it thoroughly. He just applied red chili powder and turmeric powder on that wound, and it healed. And he didn't remove it for 2 3 days. And there was no regular dressing, there was no medication, there was nothing. I remember I was quite young at that time. I said, how it's not possible? So actually, this has a wound healing process is a natural process. We do the stitches. We say we will remove it after 7 days when it will dry. Yeah. So this is a natural process. It takes some time to get heal, dry. Got my point?
Yes, ma'am.
Okay. Now, last one. Which one is accurate?
First one.
First one.
See, grammatically both are correct, but when I said which one is more accurate, then it is the first one because that's in a passive form that it would be appreciated. Always use passive form instead of saying I would appreciate. Even if you pronounce it, you will see I would appreciate. This sounds very egoistic. You say it would be appreciated if you do that. That
Yeah.
sounds, yeah, that sounds more polite, isn't it?
Yes, ma'am.
Yes, ma'am.
Great. Now, a few tips, and of course, you need to remember You have to organize your information very clearly. Write the purpose in the purpose very clearly, highlight it in the first line, because sometimes I say that most of that would not be wrong if you're writing, I'm writing to refer Mr. X who is experiencing asthma. But if you will write the purpose first, it gives more clarity to the person, to the reader. If you write, I'm writing to refer Mr. X who requires your urgent assessment as he's experiencing asthma, worsening of asthma. So write the purpose first, highlight it clearly. Now, next is be clear about the level of urgency for the communication. Very imperative. If you will miss the urgent word, if it is written in a task like immediate, urgent, and you missed it, definitely you'll not get B. It would be C plus if you miss this urgency level. It could be even 290, 300 between that range. So one word, just urgency, is very important, because as a reader, as a person, if you're writing this letter to me as a doctor, I will understand that you need assistance immediately now, or probably I'll see it after a week or so. You know, in UK and everywhere, you know, they get a long list. Even for the heart surgery, if they say the age, if you are 60 plus, they'll give you a date after maybe 6 months. So the level of urgency in communication is very important. Don't forget that. So always keep in mind the reason why you are writing and to whom you are writing. Because then you will come to know, if I'm writing to a dietitian, I know what is the role of dietitian, what she's gonna do. So then you will choose the relevant information. Content should be related to purpose. As I said, content means itself you are explaining the purpose in the first paragraph. Always ask yourself before you start writing, plan it. Okay, so this lines comes under the purpose. Oh, all right. If this is a purpose, is this the right explanation if I'll write in that way? You know, do a brainstorming before you start writing it. Don't waste time in erasing and rewriting. It's better you plan it first, organize well. Okay, so this is my purpose. I'm gonna explain what is the reason for this. Okay, this information. Okay, so this I'm gonna write in the first para. And then of course, the way you write, your tone has to be very neutral and professional tone. There is a difference between a speaking and writing language. So you should write more professional. Okay. I hope it's clear to you.
Yes, ma'am.
Yes, ma'am.
So my request that please read. There are few golden points which I want you guys to write down. Number one, purpose has to be written first. And there are three things you're going to mention in the introduction. Golden rule of three. Now, first, purpose. Second, current situation. Current situation. It's good to write in the present sentence. Let's say patient underwent surgery. Instead of writing that underwent surgery, you write in a present tense, present sentence that he's recovering from this. He's recovering from hip surgery. Okay, so that's way in the introduction, and third is a discharge plan, which you will mention in the intro. So these 3 points has to be there. If there is no discharge admission, then of course no. But you're gonna tell it's discharge tomorrow, or if it is a transfer letter is getting transferred today, tomorrow, after 4 days, or whatever. And next important thing, please don't use the dates. Write the duration. Instead of writing 20th October patient admitted, right? 5 days ago, Mr. X presented. Always write the duration instead of dates. Even there are many dates given, use it like after a week, after 2 days, after 3 days, write the duration. And most important thing, which you will never do a mistake, you will never mix two ideas in the first paragraph. You will never mix present plus past history, present plus social history. Will never do these two mixes in the first paragraph. However, you can do it in the second paragraph where you can mix up the past medical history and the social history. But no mixing in the first paragraph. If it is about, if your purpose is on the current situation, then please write only the current situation. As I gave you an example of the diabetes, you think I need to tell this information to the doctor that he is diagnosed with diabetes since 2009 and takes this medicine. No, this is secondary information for me. Primary, what happened today? He took both medication together. Because of that interaction of two medication, his sugar level went down. So this is the current information that has to be explained in the first para rather than telling me that he has this since 10 years or 11 years. Okay, if you will remember these simple 3 points, you can easily write a good letter. No mixing in the first para, explain the purpose in the first para. If you will remember that, 350 marks definitely you'll get. And use a simple language. I see that most of you try to write additional words like additionally, in addition to that, subsequently. Most of you don't know that if this is an accurate meaning or not. If you don't know the meaning, please don't write. And most of the time when you write additionally, when I correct your letters, and that is the most important information. When you are writing additionally, then the meaning change. Additionally means you're giving additional information, extra information. Got it?
Yes, sir.
Yes, ma'am.
Ma'am, can I ask one
Yes.
doubt?
Yeah.
Ma'am, the recent October, the first week exam, it's mentioned one letter requires the prescription for syringe driver. I have seen in the group you have sent one case note.
Mm-hmm.
Ma'am, in this type, because recommendation also same, because we don't have means many things to write in that, right? So how we can write in the purpose, ma'am? Directly we can ask the prescription for the syringe driver, or it's
Actually, I don't remember the task, but what you're saying that if the purpose is this only that the patient require.
yeah. That's only it's mentioned. Recommendation also same, even in the writing task also same thing as mentioned.
Then we have to write this and we need to tell the situation as well. That why does he need this syringe driver?
Okay.
So that
So
current,
even if
as I
it's
said,
coming in
yeah.
the final para, no, we need to repeat again or just
Okay. Conclusion is always
yeah.
the repetition of the introduction.
So we can
What?
repeat it in another way or
Yes, in another way.
okay.
That's what I just want to
Okay.
say. It should
Okay.
not be different. Remember that it should not be different. If your introduction says that this patient require assistance for this, then your conclusion should also say the same thing. However, you need to use the different sentences, different language, paraphrasing. For example, if I write in that neuro that it would, in a starting in introduction, I'm writing, he requires your urgent assessment and evaluation as is suspected for this and this head injury ICB. And if I write this in last paragraph conclusion, that it would be greatly appreciated if you can urgently evaluate Mr. X and find out or to rule out, just simple word, to rule out the possibility of any head injury. I'm writing the same thing, but in a different way. Is that clear?
Yes,
Yes,
ma'am.
ma'am, it's clear.
Okay, so keep these points in mind, and I'm sure, it's quite easy to get 350 marks for that. All right. Okay. All right. So see you guys tomorrow morning.
Ma'am, I have one doubt.
Yes, please. Sorry. Yeah.
Ma'am, in patient name it is written Jane, comma, Mary, in bracket MS. So first name, second name, which one?
I didn't get what is written. Mary.
Jane, comma,
Mhm.
Mary, in
Mhm.
bracket MS. Miss.
Miss. Okay. All right. So Jane is the first name.
In comma, no, Jane Mary. Okay.
Mary is the second.
And also one letter, this Beverly, this date of birth not meant, like this born 1945, like this only written. So after name, what we can write in age?
Age is not given, right? That's what you're saying.
Not
Nowhere
given.
it's given.
Uh,
Not given, then
only
not. Don't write.
born 1945, only like that.
That's a time, right?
Yeah, year only, year.
Born date of birth.
Yeah, born 1945.
Okay. So in that case, you can write the date of birth. Just write the
No,
1945. That's it.
okay, date of birth, then 1945, like that.
Yeah.
Okay.
Yeah. Anybody has any questions? Okay. All right. Then it's good. See you guys tomorrow morning, 10 a.m.